Alright, my name is Matt Buckner, and this is my full patient assessment. So I will approach this scene here with BSI. I will first determine the safety of the scene, make sure everything is okay and that there's no hazards to either me or the patient. Then I will assess the mechanism of injury. Looks like this patient here, this chair has fallen. It looks like it was probably riding a bike. I see the general impression. One patient, he's a chair, age probably about 6 months old, I'd probably say. Looks like semi-responsive, and because he did fall off the bike, I might assume that there could be some possible head or neck trauma, so I will go ahead and call 911. Okay, and I'll approach the patient here. Hi, chair. Are you okay? Are you okay? My name is Matt. I am an EMR. Can I help you today? And assuming that the chair will let me, I will first go over the ABC. So I will check its airway first by opening its mouth and just making sure that that is open and clear. Next, I will assess the breathing. So I'll make sure that there is a bilateral expansion as the patient takes a big deep breath in. And then will also just expose, I'll just pull down the collar here of the patient, make sure I don't see any abnormalities, and also expose by pulling up the shirt here and looking at its lower chest, any abnormalities or any paradoxal breathing for signs of like a flailed chest. After that, I will assess the circulation, and I will check its brachial pulse, make sure that there is a pulse. After that, then I will do just a quick sweep, a blood sweep from head to toe of the patient just to make sure that there is no blood. So I will start at the head, and I will always be exposing, check behind and behind the neck, always exposing. Check arms, body, all the way down the torso. Check the abdomen, make sure there is no wounds there. Keep going down, pat down each leg, expose, make sure around the cuffs of someone's shirt or the pant legs. Take off socks, make sure that there's no bleeding there, and we're always exposing to check for any signs of blood. I'm going to ask the patient of its chief complaint, and he does say that there is, he's got headache and neck pain, so with that I will have a bystander hold C-spine just to make sure that the patient doesn't move its head at all. After checking our ABCs, I will, because it is a trauma, I will go into a physical assessment first. So I'll do a head-to-toe assessment, and I will start with the head, and I will palpate for any abnormalities in the around the skull and also the facial area as well. Make sure that there doesn't feel any deformities. I will go ahead and check for cerebrospinal fluid in the mouth, the nose, and the ears as well. I will also do eye tracking, make sure that that is okay. After that, I can also smell the breath if there's any fruity odor. It may be signs of a diabetic coma. After that, I'll move to the neck and I'll assess the back of the cervical spine here, make sure that feels fine. I'll also check for any jugular distension or trachea deviation at all. After that, I'll go to kind of the core, and I will check here the clavicle and shoulder girdles, make sure those feel even and the same on both sides and that there's no deformities there. After that, I will check the sternum, make sure that's okay, and I'll reassess the ribs and make sure those all feel okay on each side and that there still is that bilateral expansion. After that, I'm going to move to the abdomen and do the 4-quadrant test, just make sure that there is no pain on any of the quadrants and that there's nothing that feels like it might be kind of protruding out of there. After that, I will test for the pelvis, so I'll do a compression and I'll do a stretch to see if there's any fractures there. And with that, I'll also ask the patient if there's any trauma to their genitalia at all. After that, I'll move down to the legs and I'll do a pat down of the legs, on both legs, just to make sure that they are still good and there's no deformities there. And then I'll move down to the feet and I'll check for CSM. For CSM, I'll just check for a capillary refill in the toes. I'll make sure that there is movement in the toes as well. And I'll also do a kind of a stroke and poke test to make sure that they can kind of differentiate those sensations. And then I'll also assess strength as well by having them push against my hands with their feet. As soon as that's done, I'll move back up here to the arms and do a physical assessment of both arms, making sure that they're okay. And then again, we'll do a CSM test there, making sure that there's capillary refill in their fingers, that they can move their fingers, and as well the stroke and poke test again for sensation. And then I will also do a strength assessment and have them squeeze both hands with their hands to make sure that that strength is equal. Because we do have them in C-spine here, we do want to assess their spine and make sure that is okay. So we are going to log roll them, but you're going to go based off of the person who's holding C-spine. So assuming they say and roll in 1, 2, 3, so we'll roll them over here. And then once they're in this position, we can leave them in this position because it's probably more comfortable for them, depending if they want to be prone or supine more than they can. But this is usually a pretty good position. With that, we'll assess kind of their spine all the way down, and then we'll also do another assessment, just make sure the gluteal and the back of the legs, that all looks good and there is no bleeding with that. As soon as that is done, that is kind of the end of the physical exam. After that, I can take their vitals. I do want to establish a kind of baseline vitals with that. So I can take their pulse with the radial and do that for 30 seconds, and then also watch the breathing and assess their rate and quality for both their heart rate and their breathing. After that, I do also want to do a test their level of consciousness or responsiveness, I guess. So with that, we can ask name, where they are, time and place, and kind of what happened or what's happening right now. And then after that, we can do, we look at their skin, make sure, take note if it isn't pink, warm or dry. And then also we can do a pupil test here. So we can either do that by just closing eyes here or having them shut their eyes, covering up or whatever. Make sure that the pupils are equal, round, and reactive to light. And finally, we're gonna test for their blood pressure. So I'm gonna assess make sure they have a pedal pulse. If they do, their systolic blood pressure is at least 90. After we assess kind of those baseline vitals, then we can go to more of a medical assessment using samples. So we're gonna first look at the signs and symptoms. And the onset of those signs and symptoms, and then anything that kind of provokes or makes that better, those symptoms better, and then we will look at the quality of those, possibly the pain, whether it's sharp or achy or dull, something like that, and then whether that pain radiates at all, and kind of see where that goes. Then we'll look at the severity of the pain on a level from 0 to 10, as in you need to go to the hospital. And then after that, just time of the injury, when this happened. After that, we can assess allergies, any food or medication allergies, anything of those kind of sorts, or animals. And we want to know what medications they're taking, over the counter, prescribed, or any recreational kind of medications. And then any past or pertinent injuries, or their kind of medical history in general, if anything kind of relates to this. In this case, if they had any head or cervical trauma in the past. After that, we do want to know the last time that they ate and drank water, as well as peed and defecated. And then finally, just assess kind of the whole event as a whole and kind of like what happened leading up to this. So after we do that medical assessment, then we can just continue to monitor vitals and do treatments kind of based off of that, as well as treat for any signs of shock that may occur. After that, that is really kind of that whole assessment, and you just kind of wait for paramedics to arrive and watch over the patient and properly hand the patient off once they arrive.